So let's move on now to testosterone. So you probably think of testosterone as the male hormone, right? But women have testosterone too. And we actually have a lot more testosterone than estrogen. Did you know that? So testosterone is important to keep us strong. It keeps our bones strong, so when you fall down, you don't snap like a twig. It keeps your muscles strong, so good for energy and endurance and stamina. It keeps our skin strong, so we don't get saggy skin. And it's important for everything to do with sexual function, and it's important for how we feel on the inside. It's our confidence, our self-esteem, competitive drive, motivation, assertiveness. So when we go through menopause, testosterone levels can decline, and our physical health can suffer, and how we feel can change as well. So let's talk about testosterone for men. So testosterone, all the same things: strength, bone strength, stamina, endurance, competitive drive, confidence, self-esteem, motivation, everything to do with sexual function. Especially for men, low testosterone comes with an increase in the risk for heart disease, dementia, diabetes. And so having good balanced hormones has implications for being healthy for a lot of years, as well as feeling good right now. So a lot of doctors, more and more doctors, are learning that there is a different way to address hormones by using bioidentical hormones, which means a natural form of hormones that are a match for the hormones that your body would have naturally made. But simply measuring your levels and then writing a prescription for what you're low in isn't really enough. It's preferable than writing a prescription for a drug, but still, we haven't really identified the cause of the hormone imbalance. And even if you say, well, it's menopause, but not everybody who goes through menopause has a problem. There's lots of women who just slide right through menopause. They don't even know what a hot flash feels like. So if you're someone who's having menopausal symptoms, we want to understand what are the underlying factors that are causing you to have the menopausal problems, and we want to fix those. Even if we still need to give you hormone replacement, at least you're going to get better results with less risks. So let's talk about some of the causes for hormone problems and many other problems. So one of them is all of the toxins in the environment. We live in this crazy world where there are tens of thousands of chemicals that are man-made, especially since World War II. Most of them were never studied to make sure that they're safe. And a lot of them are what we call endocrine disruptors, hormone disruptors, meaning that they interfere with how your hormones work. They cause thyroid problems and cortisol problems and menstrual problems and infertility and diabetes. We didn't really talk about insulin yet. That's the one that regulates your blood sugar. But a lot of these endocrine disruptors cause problems with your blood sugar hormones, and they promote diabetes. They cause us to gain weight. And they're everywhere. They are in the food that you eat. They are in the skincare products and shampoo that you put on your skin. They are in plastics. They are in the cleaning supplies when we clean our homes, the air we breathe. Toxins are everywhere. So we want to try to do our best to protect ourselves from unnecessary exposure to toxins. We also want to make sure that our body is doing a good job of clearing the toxins that we're exposed to. So your liver is the main organ that helps you clear toxins, and so you need your liver to be healthy and doing a good job. And there are certain nutrients that your liver really needs to be able to do a good job. So making sure that your liver detox pathways are working well is a really important part of restoring overall wellness. Here's another really common thing that we see, which is hidden food sensitivities, which means that you're eating something that's perfectly healthy for everybody else, but your body is having an immune reaction to it, and it can cause all kinds of symptoms. So it can cause indigestion and diarrhea and gas bloating and things like that. And that's more obvious. If you get an upset stomach when you eat certain foods, it makes it easier for us to figure that out. But you don't have to have any digestive symptoms. Your stomach can feel perfectly fine, and this can still be going on, and it can be causing insomnia, fatigue, weight gain, achy joints, skin rashes, all kinds of problems that you would not really necessarily associate with what you're eating. We estimate that probably 1 in 3 women has a hidden food sensitivity. So it's really, really common. And if we can figure that out, it can make such a big difference, especially with hormone problems. So when women are perimenopausal, meaning the years leading up to menopause, or they're going through menopause, and they have a hormone problem, so age probably has a big part to do with it. But we see lots of women who have hormone problems when they're teenagers, in their 20s, in their 30s. So now it's not age, but sometimes it's hidden food sensitivities. And if we can change your diet, the heavy periods or menstrual problems, infertility issues can get a lot better. Here's another really common one. In your digestive tract, we all have trillions of bugs that live there. All kinds of bacteria and yeast, and you need the good healthy bacteria in order to be well. The good bacteria, like the probiotics, like in yogurt, they keep your colon cells healthy, they help you digest your food, they actually make some of your vitamins, they regulate your immune system, so your immune system is doing a good job. But there are a lot of reasons why your digestive tract might not have enough of the good ones and end up having too much of the bad ones. So one of the reasons is prescription medicines, antibiotics, pain medication, birth control pill, antacids. There's all kinds of prescription medicines that can do it. Stress, sugar, alcohol, hypothyroidism, pesticide residues in the food that you're eating. So most of us have a couple of things on that list. So it's another really, really common one. And if we can correct that, digestive symptoms get better, but often a lot of other symptoms, including hormone symptoms, get better as well. So if you are eating a food that you're sensitive to, it causes inflammation on the inside of your gut, whether you feel it there or not. If you have an imbalance in the gut bugs, that also causes inflammation inside your digestive tract. So if you've got inflammation in your gut, it may not be doing a good job of digesting and absorbing the food that you're eating so that you're getting the nutrients in your cells. So when we talk about your nutritional status, we mean what you're eating, but we also mean what you're digesting and absorbing and getting into your cells. So sometimes looking at your nutrient levels can help us to identify if there's a problem. But the first way to fix that isn't to stock you up with vitamin E and vitamin C and zinc and all these different vitamins. The first treatment is go back and correct the health of your digestive tract so that you can properly absorb your food. So one more factor that is underlying chronic disease is our lifestyle habits. Whether you're exercising, whether you're getting enough sleep, what kind of stress you're under, what kind of food choices you're making. So I can help people by looking at their hormone levels and their nutritional status and recommending vitamins and things like that. But if you're eating Bojangles for breakfast, McDonald's for lunch, and KFC for dinner, there's only so much that I can do. And the flip side of that is true too. You can eat everything organic, and you can do yoga, and you can meditate, you can do all the right things for yourself, but sometimes there are some of those other factors that you just can't fully compensate for with a good lifestyle habit. And so sometimes, really the best way to go about it is to look at the whole picture. Does this make sense? So instead of writing drugs to treat symptoms, this is how I approach things now. First, we do a really nice lab assessment to understand, do you have hidden food sensitivities? What is your nutritional status? What is your hormonal balance? Do you have too many inflammatory chemicals in your body? Do you have enough antioxidants in your body? We really want to understand your unique biochemistry. And it really boils down to this. What do you have too much of that we need to get rid of, like toxins or too much cortisol? Or what do you not have enough of that we need to add, like thyroid hormone or zinc? And then we put together a program so that we can correct those problems, and we work with people on an ongoing basis to mentor them through the process in order for them to reach their health goals. And that mentorship part is important because there's a lot of information out there. And you can read stuff on the internet, and sometimes it's true, and sometimes it's not, and sometimes it's really hard to tell the difference. And sometimes it is true, but it's just not true for you. And so having somebody to work with you to help guide you through this process can be very helpful. So, one of our reasons to be here tonight is to let you know that there is a different way besides just taking the drugs. And the other reason for us to be here tonight is to try to motivate you to take some steps in the right direction. So, I want you to ask yourself these things. If you could resolve your health issues, just what would that mean to you? How is your health affecting you? How is it affecting your relationships with your spouse or your kids? How is it affecting your coworkers and your career? And are you able to enjoy a full quality of life and really do all the things that you love to do, like gardening or dancing or whatever it is that you're really passionate about? And how motivated are you to really get to the root of the problem? Hopefully by the end of tonight, we'll have you moved a few steps in the motivation direction to really get stuff accomplished. So here's my motivation. These are my 4 boys. And this picture was taken a few years ago, so the oldest 2 are already in college, and all 4 of them are taller than me now. But around the time that this picture was taken is when I wasn't doing so great myself. And I can tell you that it is hard to be a good mom when you're tired and irritable and you don't feel good. And so then what happens is you add to the list. You got anxious and tired and irritable and guilty. And it really affects those around you. It doesn't only just affect you. And sometimes we don't realize how much our health is affecting the people that are around us. So here's another motivating factor for me. Both of my grandmothers lived to be over 90, but they had Alzheimer's for many, many years before they died. So this lady in the wheelchair, it's just a picture I found on the internet, but it could have been either one of my grandmothers. For many years, they didn't recognize anybody in their family. They had to have somebody feed them and care for them. So you know that that's not what they wanted for themselves. That's not what I want for me. I don't want to be a burden on my family, and I know that you don't want those things either. The lady on the other side, she is 88 years old, and she is the world's senior gymnastics champion. So I can tell you, I tried to do that just at home on my chair. I can't do that. And she's not swinging either, because there's video of her. She's holding that pose. So we all know which side we'd want to be on, right, if we could choose. But we tend to believe that our future health depends on our genes. And the reality is really only about 20% of your future health depends on your genes, and 80% depends on the choices that you're making today. So if you would rather be on that side of the screen, now is the time to make the changes, and now is the time to start. So hopefully we will motivate you to make some good changes in your life and move in the right direction, because the people who care about you and the people who depend on you really want you to make good decisions. And you know, sometimes men don't make all the right choices because men don't like to go to the doctor. But for women, the reason that we often don't make all the best choices is because we're so busy looking after everybody else, and we put ourselves last. But when you're on the plane and those oxygen masks drop, who do they tell you to look after first?
You.
And why?
So that you can breathe to help someone else.
Yeah, because you can't help anybody if you're incapacitated, right? So we need to be looking after ourselves so that we're able to care for the people that depend on us.